Hi, my name's John. A week ago on Monday, a series of events began that ended in mine being diagnosed with Bell's Palsy. Uh, it began with a bit of a headache actually on Monday. It had lasted for around 3 or 4 days, and although it wasn't a severe headache and I was able to cope with it okay, it was relatively mild. Analgesics were doing nothing to relieve that discomfort. I came home on the Thursday from work and realised that my left eye was very dry and wasn't closing very well. And of course the rest of my face is frozen as well. So the result is this: Bell's palsy. My forehead, if I am to raise and lower my eyebrows, if I'm to force a smile, and blinking my eye. I mean, this eye here I can blink quite well. The other one, very difficult to close, and hence the dry eye. As I said, this all began on the Monday with a headache. I noticed at the same time that I had a really strong metallic taste just down the side of my mouth, and a numbness that almost felt like I'd had some sort of a dental procedure in a few hours before. On the Thursday when I came in from work and I noticed this rather frozen face, the whole experience was quite worrying really, because one automatically thinks that they might have had a stroke. And so I took myself down to the emergency department to see if I could get this thing sorted out. When I got there, they had a look at me and conducted some tests and diagnosed Bell's palsy. At the time, I'd only had the symptoms for about 4 hours by the time I actually sought treatment. So I was quite lucky, really, because they gave me some drugs, one called a prednisone, which is a steroid type treatment. The idea of the steroid is to improve your chances of getting a full recovery, and also to reduce the period of time that full recovery might take. From what I've heard, it's around about an 80% chance of a full recovery and maybe another 10% of a partial recovery, with a small chance of little recovery at all. I feel like I'm quite fortunate because of two reasons. Firstly, I got very good medical help very quickly, and I got the drugs that I needed straight away. Secondly, I'm in relatively good health, and I suppose that's not a disadvantage. But also, I don't think my Bell's palsy is as severe as what some people have. I don't have a terribly dripping mouth when I'm just in a static position, although there is some there for sure. But I've also already achieved some improvement in only the 3 or 4 days since I started the prednisone, and I feel like I can have some movement on the left-hand side of my mouth already. So it's not quite completely paralysed at all. So I'm feeling pretty positive. I'm undergoing the exercises and things that some people advocate, and suggest that you should continually touch the side of your face to stimulate the nerve and to stimulate the regeneration of that nerve. You should conduct exercises with your forehead and with your mouth and with your eyes to try and make sure that you get as much movement in there as you can and stimulate that nerve regrowth as quickly as possible. There are some things that are a little bit challenging. I find that I'm speaking very much out of the right hand side of my mouth, which is fine. The ears, the left hand ear has been, the noise has been quite annoying, to be honest. Any loud noise, a dog barking or somebody dropping a knife or a fork on the floor, and that clanging sound, that noises in the elevator quite substantially. And, I'll be pleased when that settles down. There's some ringing in the ear as well, especially at night. I've had to tape my left eye shut at night, simply because I'm a bit concerned that it's going to dry out. There are ointments and there are drops. The ointments at night and the drops during the daytime, and they do help. They do help tremendously, I must say, to make things a little easier. Other than that, I'm going to work in the normal way, and I'm hoping that this will recover very quickly. So I guess my message is, this is 1 week after diagnosis, and I'm hoping that in the next few weeks things can start to improve quite dramatically. So if you've got Bell's Palsy, or someone in your family who's got Bell's Palsy, well, lots of support, and they're not alone. There's a lot of people out there that are suffering from it, but the prognosis is good, especially if you get the right treatment, get it quickly, look after yourself, and exercise those facial muscles, keep them working, and try and get as much out of that as you possibly can. So this has been 1 week. I'll possibly put another one in a week from now, and we'll see how we go. Anyway, best of luck with your Bells Palsy.